We're back with Dr. Perry Cammisa. Dr. Cammisa is a chiropractor, but I'm getting the impression you're not the typical chiropractor, and we'll get into that.
Okay. And
typically I start off with questions to get you to talk about your business and stuff, but I'm going to tell you a little bit about my experience with chiropractor.
Okay.
And then you'll help me dispel all those myths. But my experience with a chiropractor has been helpful when I've needed it, accident or whatever. But I get the impression that it's just constantly coming back for his benefit, not mine. So now I see the pictures of your operations, which is completely different than what I've ever seen before. So tell me a little bit about your history, why you got into this, and then let's get into your chiropractic practice.
Great. Well, thank you so much, first of all. And just a brief history. I've been in practice since '91. Okay. I've been in the same location since '94. We're right over by the Green Trail Shopping Center. So I've been in town for a long time. And as computers have changed, technology's changed, you either do two things. You embrace it or you don't embrace it. And I started on this quest probably about 9 years ago. And it's led us down a road that has just been phenomenal. And so our clinic's called Ultimate ChiroCare. We rebranded ourselves last January. Okay. And the rebranding was critical because of all the state-of-the-art facility that we have. We wanted to come up with an appropriate name for it. And really, we set the bar for chiropractic. And so some of the things that you talk about, you know, coming back and not understanding why and repeated visits, everything we do is really through computer systems and digitized.
So, okay, I have a need or a desire to change something physically or about myself. Right. I walk to your facility, I come in, and I see digital technology, I see state-of-the-art stuff. Where do we start? How do you get me involved?
Well, that's a great question. And that's really we call it a 3D blueprint. So we basically take your posture and we take x-rays. But they're just not basic posture, not basic x-rays. So everything we do is compared to normal values, compared from research values. Okay. So we put little dots on your shoulders, and we have you wear funny glasses, and you're up against a computer board. And the computer is going to, when we take a digital image of you from your posture from the outside, the computer is going to ask, where's the shoulder marker? Where's the shoulder marker? Then it's going to compare that to what normal values would be. Okay. So we get really a three-dimensional blueprint of you from the outside that's accurate to within 1 degree and 1 millimeter, which is pretty much bullseye. Yes. So then we do the same thing with x-rays. Now x-ray has gone from chemicals and x-ray and developing and all that kind of stuff to now our x-ray room, our diagnostic room is just one big computer room. Yeah. It's all digital. And we take the x-rays that we take on you, on your spine, and we run them through a computer software system that's like I tell patients it's like a GPS system. So we were the first in the country to use this. And what this actually does, it plots your vertebrae against normal values. So we end up with basically, when we finish this blueprint of you, we have 34 pages of information on you, which is your thumbprint. It develops exercises based on these values that are unique to your spine and your condition, which would be different from my condition. Yeah. So that's really how it all starts, is from that 3D blueprint.
And this, it seems like this is the basic game plan or blueprint that we're going to move from to create some unique opportunity for me to get well.
Correct. Right. Okay. So everyone starts with that blueprint. Yes. No matter who they are, what age they are.
Because I look at that picture, and from what you showed me, it's like, if I'm the patient and I get this picture of me, I think I'm standing normal or whatever. Right. But when I'm looking at it now, this patient looks, geez, they feel like they're standing normal, but it's off. But then you go through this process now. Tell me about this, from this blueprint, where do we go?
Well, and I'll make one more point. When we take the information, the blueprint, your eyes are closed. So that's like driving the car and having your hands off the wheel. How well balanced is the car? Oh, okay. So that we know that it's your true posture. Yes. So that's how, when we take the image, that's what we're looking for, is your true posture, not your compensated posture. Yes. Okay. So then from there, we use, now traditional chiropractors have done manual adjustments. I do very little of that. It's all done by computer today. which is just amazing what computers have been able to do.
And precise, it seems.
It is amazing. So from this blueprint, we know what vertebrae, which direction, which degree, and all that kind of information. But what is critical is that we use an instrument, kind of looks like a little drill. But basically what it is, it actually sends an impulse, a mechanical impulse into the vertebrae. So if you've been adjusted before and you've felt that crack,
yes,
this is different. This actually is 100 times faster than a manual adjustment, produces 25% more motion, and the neurological input we get to the brain and the nervous system is tenfold. So that allows us to adjust anyone from an infant. The oldest patient we have right now is 89 years old. So there's no complications from this adjustment.
Yeah.
Which is one of the biggest hurdles we've ever had to jump over as a chiropractor.
Because sometimes it is painful when you get the manual adjustment.
I've been adjusted thousands of times over my lifetime, and you betcha, yeah, they can be painful. This is not like that. Because you know, if you can feel a mosquito land on your toe, we don't need to hit you with a hammer to have an impact.
Yes.
Right?
Yeah.
So,
So okay, so now we're moving through this process, and we're getting, it sounds to me you're getting very specific, great results based upon the digital technology that you have to work from.
Right. So then we go from the adjusting, and then the next part of the equation is, so that's just the skeletal system. Well, how do we deal with the muscular system? That's the part that people say, oh yeah, it's right here. It's always C2 here, or it's always, whatever the situation is, it's always the chronic same thing that never goes away because the problem's never been fixed. And so we use a technology, it's called acceleration training.
Okay.
It's a platform that vibrates. Basically what it does, it stimulates a reflex in our body, and reflexes are basically, we don't have any control when we have a reflex.
Yes.
So when we do an exercise on this platform, the reflex causes the muscles to contract. So every time the reflex gets triggered, the muscle contracts. So in 40 reflexes, we get 40 contractions. Well, that happens every second.
Okay.
So in 30 seconds, we get 1,200 contractions. So when we're doing your postural, your corrective spinal stability exercises, we're getting 1,200 contractions taking place in 30 seconds. So we get some just phenomenal changes. So
we get the bones aligned correctly, and then we get the muscles trained to allow that bone to stay there by this stimulation that we're getting, the reflexes that you're talking
correct.
about. Okay.
So, and then the last piece of the puzzle is some of the other equipment you saw, which is spinal remodeling. If their ligament's been injured, like a whiplash, migraine, so those are the two big categories that we deal with, is that there's been injury to those ligaments. We actually have equipment, and through our diagnostics, being able to pinpoint what, if it's maybe a C4, C5 in a whiplash case, we can pinpoint it and treat that ligament and try to restore the spine to a stronger, healthier, more stable position.
Wonderful. Wow. We've had 7 minutes to try to encapsulate this, and I know it's been a whirlwind, but bottom line is we have to go. We have to come in and see this, and if there's any type of pain or discomfort we're feeling, we got to come to your place.
It's a state of the art. We've had physicians as far away as Japan come see us over the last year. Probably 40 different physicians. We work with CDH Hospital, Edward Hospital, some chief neurosurgeons. I mean, it's pretty amazing what's transpired over the last several years with all of our technology changes that we've been able to implement together.
Wonderful. Dr. Perry, it's been a great pleasure to have you on.
Well, thank you.
And like I said, we've just got to come visit.
You betcha.
All right.
Thank you.
You're welcome. We'll be right back.